So I think it's fair to say that, with between 1,100 and 1,200 United Ways around the United States, it certainly, and I know this would be the observation that a lot of folks on this webinar would have about United Way, is that the way United Ways look in communities can vary quite dramatically across the country. And United Ways, based on the community conditions, based on the capacity within the United Way, based on the leadership that the community wants from its United Way, the United Way can play, very different roles. A lot of how United Ways have been traditionally known in communities is really much more as a community fundraising organization, raising money and then deploying those resources to really worthy programs, and investing in worthy organizations that are doing great work. A lot of United Ways that have been working in that space for a while began to understand and see the changes and feel the sort of changes in philanthropic giving and how people were coming together around community solutions, and began to adapt to their own community needs, the leadership that some communities wanted from its United Way, and have adapted their models over time to one that's more in the space of collective impact, as we're now referring to it. Over, though, for a long period of our history, especially as we began to focus on measuring results, not just in terms of the amount of money raised, but in terms of how much we're making a difference in community issues, we began to really define our work and impact as being very much focused on supporting those building blocks for a good life. These are building blocks that we think of as being sort of almost universal, not just in the U.S., but around the world. The things that people need in order just to ensure that they can fulfill on their greatest potential for their lives. And those three things tend to be getting access to a good education, having access to good income and the ability to become financially stable over time, and also having access to good health care and access to health and wellness, and avoiding risky behavior. I won't get into a lot of detail about this, but back in 2008, the United Way in the U.S. set some pretty ambitious goals or aspirations in those three areas. But I would say in education, income, and health, those are our three areas that become the primary focus for the community impact work that we try to focus on at United Way across the country. Again, the model and how we fulfill on that work and how we accomplish that work may vary, but those are essentially the three main areas. Where we see United Ways making a lot of progress in those areas is when they are taking on a much more aligned approach, working across sector, galvanizing and serving as sort of the glue or the backbone for a collective approach to some meaningful outcomes that create real systemic change in communities. And just some examples of what that looks like today are in each of those areas, in education and financial stability and health. One example I'll mention is in the education space, and that is in some cases, and in a lot of cases now, increasingly so, our partnership with Strive Together, where we, with local United Ways and Strive Together, have begun to really go deeply into the collective impact models around cradle-to-career advances to help ensure that young people have an opportunity early in life until early adulthood to succeed, especially in education. One of the great examples of this is one in Albuquerque, New Mexico. It's called Mission Graduate, where they focus on ensuring that there are an additional 60,000 new graduates with college degrees or certifications in central New Mexico by 2020. And that's a very collective approach between education leaders and other government leaders, university leaders as well, those in higher ed, public school leaders, parents, teachers, schools, especially focusing on the diverse community in Albuquerque and making sure that there's an opportunity for success, cradle to career. It also ensures that employers are at the table to make sure that as kids are receiving an education that they're adequately serving as a prepared workforce and building a prepared workforce in central New Mexico for the employers that are there. And in fact, this effort has really invited central New Mexico employers to commit to collecting data, to making sure that that the work that's being done in Mission Graduate is also producing the kinds of future employees that employers are seeking. In the health area, We've got some great examples, and a lot of these examples aren't all from our largest United Ways, and that's another issue we may come back to. We have some smaller and medium-sized United Ways that are doing some incredibly innovative kinds of work. There's an initiative in Santa Cruz, California called Go for Health, which is working hard on addressing childhood obesity through a very collective approach. One interesting little tidbit there is that they've even brought in a collaboration with the Santa Cruz Transit Board of Directors, with restaurants and others to set a collective goal to reduce obesity by at least 10% by 2020, and they're actively working across sector to accomplish that goal.